You know, every single time you visit a doctor, this digital file about you gets a little bigger. It's filled with some of your most personal, private information. But what if that file, when you combine it with millions of others, actually held the key to curing diseases? Well, today we're going to dig into this huge tension between our right to privacy and the absolutely incredible potential locked inside our collective health data.
So let's just jump right in with the big question, the one that gets right to the heart of this whole thing. Is it possible that the very systems we've built to protect our individual data are actually getting in the way of saving lives on a massive, massive scale?
To really get a handle on what's at stake here, we first need to appreciate the unbelievable and largely untapped power that's currently just sitting there, locked away inside our medical files.
Okay, so these electronic health records, or EHRs, there's so much more than just digital filing cabinets. Think of them as a potential gold mine. I mean, if we could combine them, we could analyze data from millions of people to find new cures, right? We could answer questions that would be completely unethical or impossible to test in a normal clinical trial. We could even spot the next pandemic before it explodes and fix the huge problem of minority groups being underrepresented in medical research. It's a game changer.
So, if this data is really that valuable, what's stopping us? Well, this brings us to a really fundamental ethical conflict, a genuine conundrum right at the heart of modern medicine.
On one side, you've got these principles that are the absolute bedrock of medical ethics. Your privacy as a patient, your right to control your own information, and that essential trust between you and your doctor. But then on the other side, you have this immense societal benefit, the public good, that could come from using all this data to develop new treatments and maybe even wipe out diseases for good.
And as it stands right now, the balance is tipped, and it's tipped heavily towards individual privacy. The main gatekeeper for any researcher who wants to access this data is a process we're all pretty familiar with. It's called informed consent. Basically, you have to explicitly say, yes, you can use my data.
Now, on the surface, that sounds perfectly reasonable, right? Of course it does. But here's the catch. Relying only on consent creates this hidden but critical flaw that can basically poison the research before it even gets started. It's a huge problem in science called selection bias. Imagine this. You're trying to test a new heart medication, but only the absolute healthiest people, the marathon runners, agree to share their data. Well, the results would be completely, dangerously misleading for the older, sicker people who actually need the drug the most. You end up with a totally skewed picture of reality.
And the scale of this problem is pretty significant. Studies show that, roughly half of patients consent to sharing their data. But here's the crucial part. The group of people who say no is systematically different from the group that says yes in things like age, health status, income, you name it. And the differences are unpredictable, which means you can't just, correct for them with some fancy statistics.
And the real-world impact can be absolutely devastating. Get this, when a cancer registry in Hamburg, Germany introduced a strict consent requirement, their data pool shrank by 70%. 70! All sorts of crucial research just had to be shut down.
So the takeaway here is that our system, which was designed with the best of intentions to protect individuals, might actually be harming the public by producing flawed, incomplete science. It could be leading to deaths and diseases that were in fact totally avoidable.
This is where a really powerful ethical argument comes into the picture to help us reframe this entire problem, to look at it from a completely different angle.
It all starts with this famous thought experiment from the philosopher Peter Singer. And the idea is really simple. If you can do something hugely important, like save a child's life, at a very, very small personal cost, in this case, just getting your clothes muddy, do you have a moral obligation to do it? I think most of us would say, yeah, of course.
And this idea leads to a principle called the duty of easy rescue. It's not about grand sacrifice or being a superhero. It's just about our basic obligation when we can stop something terrible from happening with very little effort on our part.
And this is where it all just clicks into place. When we apply this to our health data, the cost of getting your clothes muddy is that tiny minimal risk of a privacy breach from sharing your anonymized data. And the rescue, the drowning child, well, that's the enormous collective benefit of curing diseases and saving countless lives.
And this risk isn't just theoretical, it's actually been quantified as minimal. The estimated chance of your health record being breached by your healthcare provider is about 0.02% a year. That's about 1 in 5,000. It's a level of risk we as a society already accept for other public goods, like mandatory vaccinations.
So when you frame it like this, the whole ethical calculation starts to look very, very different, doesn't it? Is a tiny personal risk really worth foregoing such a massive public benefit?
Okay, so how could we actually do this? How could we put this ethical principle into practice safely and responsibly? Well, the final step here is a proposed framework that turns all this theory into a practical solution.
The proposal is for a clear, risk-based framework. So instead of a blanket, one-size-fits-all consent rule, every research project would get evaluated. Step 1. Is it valuable? Is it likely to help people? Step 2. Is the data super sensitive? Step 3. What's the actual risk here? And then, based on those answers, you determine the path forward. Low-risk research could proceed, while higher-risk stuff would absolutely still require your consent.
And to be clear, this wouldn't be a free-for-all, not at all. It would be a carefully managed system. You'd have an expert authority making these decisions, using cutting-edge security. Think distributed databases instead of one big, hackable file. Consent would still be the rule for anything more than minimal risk. And really importantly, there'd be a system to compensate anyone who was ever harmed by a breach, plus a huge effort to educate the public and build trust in the whole process. And that leaves us with this final, really provocative thought. By reframing this whole debate around that idea, the duty of easy rescue, we have to ask ourselves a totally new question. If we can contribute to life-saving science with almost no risk to ourselves, is it still just a personal choice? Or is it maybe something we have a duty to do?